Well, hello everyone. I hope you've had a break during the summer, and as we get into this difficult autumn period of the year, that you're not feeling too down about the weather, but you're able to keep active and have some friends and do some sort of things to enjoy your time. Today's episode that I want to cover is about those of us who are struggling with this whole condition of what the experts tell us is bipolar. And sometimes it's very difficult to understand what bipolar is and whether we are suffering from it, whether we're an adult, a young person, or whether one of our children are struggling with it. So what is bipolar? Well, I'd like to ask you, do you go through extreme mood changes with your behaviour and your moods? That's where I want to start with this question. Do you get much more excited or irritable than other people you know? Do you notice that you go through what we call periods of extreme highs and lows in your mood and energy levels more than other people? Do these mood changes affect you when you're at school, work, or in the home? Because some children, young people, adults with these symptoms may have what we call this bipolar disorder. It's seen as a mental illness that causes unusual changes in our mood, energy, activity levels and day-to-day life. But with the right help and support, those of us who are struggling with this bipolar condition can improve their life over time. So, what are the symptoms of this bipolar condition, disorder? Mood episodes when you have bipolar can include very intense emotions and changes in your sleeping habits, your activities. You may do very few activities because of the way you're feeling. You may not have much energy. Your thoughts may tell you, I can't be bothered, I haven't got the energy. And you may have what we call manic episodes of lots of depression. That's what we mean, where you feel really down for a long period of time. But you can have what we call mixed episodes as well of this depression, which is manic and depressive symptoms together. So these mood episodes can cause symptoms that often last several days or weeks. And you may find during an episode that the symptoms happen every day and last for most of the day. These moods and this activity changes are very different for people who you know who are behaving ordinary. So you know something's wrong when you look at other people and you feel, well, my mood changes are very different. They're more extreme, and the way I behave affects the way I think and act, and it seems to be different from other people. So your behaviour is obviously about thinking around this whole area of bipolar condition. So if you have this manic episode of bipolar, what can you experience? Well, we're told that you can experience intense happiness or feeling really down for long periods of time, have a short temper and get very irritable with people for no reason at all. You may start talking very fast about a lot of different things that you don't normally talk about in the same way. You may have trouble sleeping and yet you don't feel tired. You may have trouble staying focused on anything in your life from day to day and experience what we call racing thoughts. That means that your thoughts are all over the place. and they go from one thing to another, and you haven't got much peace in your life. And you may seem very over interested or involved in pleasurable things, but it involves risky behaviours. So you may do risky things that show poor judgment, because you're not able to focus, concentrate, and really work through whether what you are doing, how it will affect you in a negative way and also other people. So those of you who have these depressive episodes may have very frequent and unexplained sadness too. So the sadness is something to really watch out for. You may, as I've said, show increased irritability, quite a lot of anger and aggression that you realise you don't often have in your life. You may complain about a lot of physical pain that you don't know where it's come from, such as stomach aches and headaches. And then you start to feel that you want to sleep a lot more than usual. You have difficulty concentrating, feeling quite hopeless at times, and that you're not worth anything. You may have difficulty when you talk to other people, and keeping friendships with others, and just basic relationships with people may become more difficult. And then of course this bipolar condition does affect our eating. You may eat too much or you may eat too little, and as a result of that you have a lot of low energy and no interest in doing anything that you normally enjoy, because what we eat or don't eat does affect our mood. And you may start to think about death or have thoughts of suicide, which is not good at all. So what causes bipolar disorder, you may be thinking? Well, bipolar disorder is normally called a manic depressive illness. What do I mean by manic depressive illness? What we mean by that is people experiencing sometimes very extreme changes in their mood and behaviour. And it is a common understanding that children cannot have a bipolar disorder. But this is not true, because children can have bipolar disorder, but it needs to be carefully diagnosed by a medical person. Although most people are diagnosed with bipolar in their teenage years or adulthood, these symptoms can appear earlier in childhood, as I've said, but your medical specialist, like a doctor, will be able to tell you that. So bipolar disorder is not the same as the typical ups and downs in a person's everyday life that they go through. The mood changes in bipolar disorder. It's more extreme and often unexplained, and it's followed by changes, as I've said, in your sleep, energy levels and ability to think clearly. So any diagnosis for a bipolar disorder can be quite complicated, and it needs careful and very thorough working through by a trained professional like a doctor or a health specialist. But with treatment, children, teenagers and adults with bipolar disorder can manage their symptoms and lead a full active life. So how does this bipolar condition affect your lifestyle? Well, young people with bipolar sometimes feel very happy or up, hyper, feel quite hyper, and are much more energetic and active than they usually are. And as we've said, this is called a manic episode. Children with bipolar disorder sometimes feel very sad and down and are much less active than usual. and this is called a depressive episode. So bipolar disorder often happens in intervals, but it usually lasts over quite a long period of your life. And the disorder symptoms can make it hard for you to be at your best in your thoughts and in your behaviour in school, at work, college, university, and it can really make you struggle in getting along with your friends and family members and other people. And some people who have bipolar disorder struggle so much that they attempt to try and hurt themselves or attempt thoughts about taking their life. So early diagnosis and treatment by a doctor and the support from a counsellor can really help you manage your condition a lot better over a long period of time, and can help you put some safeguards in your life around keeping yourself well and keeping yourself alive and active. And some people who have bipolar disorder may have other symptoms of other disorders in their life. It's quite possible to have ADHD or some kind of anxiety issues or autism, and maybe you know people like that. Maybe you're one of these person that you're having to struggle with other things at the same time. And some people who are struggling with this condition of bipolar may also be at risk of misusing alcohol and drugs as a way of coping, and they need some extra help around their addictions during this time. And sometimes these extreme behaviours take place with mood episodes. During the manic episodes, people may take extreme risks that they wouldn't normally take that can cause them harm or injury. So if you're one of those people, it's so important to look after yourself, to go for counselling, to let your doctor know what's going on for you, so that you're protecting yourself and other people. And some people talk about running away from home or having thoughts of not being with other people, wanting to be on their own all the time. And that's another warning sign, again, that you need to perhaps see a counsellor or go and see your doctor about what's going on for you. And when you do get diagnosed for your bipolar disorder, whether you have that condition or not, a professional like a GP will carry out a diagnosis, and they'll ask you about your sleeping patterns and your relationships with other people and your moods, and they'll also ask you about your eating habits, and this will help you to understand your condition and help them to know what kind of medication to give you. So what treatment can help you? Well, it's important for you to work with your doctor to develop some kind of treatment plan that can help you manage some of the feelings and thoughts that you get with this condition and improve your quality of life. And it's important to follow the treatment plan, isn't it? Because even when you're not currently experiencing some change in mood, it's very easy to think, oh, I can stop taking this medication, I don't need it anymore. But that's not going to help you long term, because you can't control your life when you're living and experiencing this bipolar condition. And several types of medication can treat your symptoms depending upon what the doctor feels you need. And people respond to medication, don't they, in different ways. They may need to try different types of medication from their doctor to find which one's the best for them. They may need more than one type of medication because their symptoms are more what we call complex. But you'll find that your GP, your doctor, will usually give you fewer number of medications to start with, to see if that improves your condition. But also, it's very important for you to ask your doctor about the side effects to medication, especially if you're having more than one type of medication recommended to you. And if you want to stop taking the medication, please speak to your doctor first, because it can be very dangerous to stop and it can make your symptoms worse. So the different kinds of counselling can help you manage this condition of bipolar as well. So a counsellor can help you to manage your routines in daily life and over a long period of time, and help you improve your relationships with others, and help you manage your emotions and understand what triggers them. So what can we expect from any treatment that we have? Well, with treatment, daily life and your well-being can improve over time, and it's important that you work with your GP, your doctor, take your medication, see your counsellor, and it's important that the people you see are working with you together so that you can get the best overall help as possible. And sometimes after the help you get, your symptoms may change or disappear, and they may come back again. So it depends on the treatment and the support you have. And if this happens, your doctor may recommend changes to your treatment plan. But it's important to stick to that treatment plan, as we've said, to reduce the number of future episodes of extreme behaviour. And your doctor may provide a recommending keeping a daily chart of your mood changes to track your behaviour, sleep patterns and moods. But this will make it easier to track the symptoms and see whether your treatment is working. So that's your GP's involvement in this condition of struggling with bipolar. But from a counsellor's point of view, a counsellor can help you in a number of ways and help you to look at a lot of things you can do to help yourself and stay well. They can help you to learn how to recognise the signs that you are getting unwell so that you can get help early, help you keep a mood diary that can help you identify things in your life that can help you that perhaps you never thought about before, and also those that don't help you. And they can help you to find out about your condition a bit more through signposting you to reliable information and resources, well-being centres locally that can support you. They can also help you to avoid stressful situations that make your situation worse. It's not possible to avoid all stressful situations, but it may be helpful to learn and be aware of how to manage those situations. And also the important thing, as I've said before, about doing relaxation and meditation exercises to relax your body and mind, and also to help you to be open with other people about how you're feeling and how your bipolar condition is affecting you. And this can help other people to understand your condition and to support you in a meaningful way, such as a counsellor. Try to make time for the things that bring you alive, that you enjoy. Don't stop doing your activities while taking plenty of time to relax and unwind. And I know that's difficult if you have got a very demanding school timetable and exams, pressures from teachers or university lecturers or college staff, or maybe employers at work are really putting pressure on you. But it's important that you protect yourself and manage your own time and your own life, and get the support of somebody like a counsellor to help you do that. So it might even be about, how can I start a new hobby, or restarting an old one that I've neglected. And this is going to help you manage your bipolar condition a lot more effectively. Spending time with other people or joining a youth club, that's something else that will really benefit you. And try to stay active by doing a form of exercise that you enjoy for about 20 minutes, half an hour a day, say 3 times a week, because it's good for your mood. When you're exercising, you're able to express, and you're able to get rid of a lot of that stress that you're carrying around. And as I've said before, keep taking your medication given by your doctor. It can feel very tempting to stop, especially when you're feeling well, a bit better, but always speak to your doctor before making any decisions about your medication. So finally, how can you support yourself? Well, we've already mentioned a number of things, but it's important, isn't it, to be very patient with yourself. Talk to someone that you trust, like a counsellor, as I've said, about your feelings. Pay attention to those extreme or changing moods, and be aware of new changes in your thinking and your behaviour and your emotions, and understand the triggers for managing these very difficult emotions, and what makes you feel quite irritable with yourself and other people. Keep doing your leisure activities that bring you alive, and remember that treatment takes time. Sticking with the treatment plan can help you get better and stay better, and it can help you understand that treatment that can make your life better. So I hope some of the things that I've said about bipolar condition is helpful to you, and I hope it's going to help you to think seriously about whether you need any further help, whether you need to see the doctor to get checked out, whether you need to go and see a counsellor. But the important thing is not to be alone and to think, I've got to live with this and I'm not sure what it is, because that is not a good place to be. And it's also about keeping yourself safe as well. I hope to talk to you again soon. Do look after yourself, and remember that you're not alone. There are other people out there who can support you. Bye for now.